The government is issuing new mammogram guidelines that say women should wait until they are 50 years old to get their first breast cancer screening, instead of the normally recommended age of 40.
We found that screening starting at age 50 captured the majority of benefits. There were additional benefits to screening starting at age 40, but the benefits starting screening at age 40 were smaller, and they were accompanied by significant harms to women.
Dr. Mandelblatt led teams of doctors all over the world using data on cancer and mammography to determine what would happen if women were screened at different ages and frequency. The results of her team's independent research were then given to a government task force, and only part of the results used to make the changes.
By harms, I mean there were women that would undergo false positive exams, unnecessary biopsies, and even be treated for cancers that would never have harmed them.
The new guidelines say women ages 50 to 74 who are not considered high risk should get mammograms every other year instead of every year. The American Cancer Society has a different opinion.
And we have analyzed the same evidence. We feel that there's not a sufficient evidence at this point to warrant a significant change of the type that the task force is recommending. So we continue to recommend, if you're at average risk of breast cancer, start at age 40, get a mammogram every year.
The American Cancer Society is also concerned the new guidelines will change the way women think about getting screened.
If women say, I'm so confused and they're so confused that why should I do anything at all?
While the debate of when and how often to get a mammogram will continue, both sides agree on an important piece of advice.
Our results can only be used for one piece of evidence. All women should talk to their doctors about their specific conditions to understand the best screening policy for them.
The new guidelines will be published in Tuesday's Annals of Internal Medicine. Lila Ibrahim, The Associated Press,